I am Dr. Kaustubh Durve, Senior Consultant in Orthopedic Surgery at Apollo Spectra Hospitals. I specialize in knee and shoulder surgery, and I have trained extensively in arthroscopy and joint replacement, including ligament surgeries in the UK. So, when I advise a patient to have a surgery on the knee, most often it's a knee replacement surgery or an arthroscopic surgery. The first question that the patient asks is it worth it going through all of this trouble, and what do I expect? Uh, I can understand that any knee surgery will cause anxiety because these knee surgeries are not emergency surgeries. It's not like a life saving surgery that without the surgery the patient is in trouble. These are surgeries which are meant to improve the function of the knee and to improve the function of the patient. So, first thing that patient thinks is, am I going to get better after this surgery or am I going to actually get worse? I am at a loss to understand why patients think that they might get worse after surgery. Some patients have shown me some examples where there might have been some complications, but these are usually in the older days. Particularly knee replacement surgery in the older days used to be done by surgeons who are not very experienced perhaps, or in hospitals which did not have the kind of equipment, infrastructure and cleanliness which you need for these kind of surgeries. In the recent times, and definitely at our institution with my patients, I can tell you with complete honesty and confidence that our complication rates for knee surgeries are well below 1 in 500, which means like any operation, there may be some complications once in a while, but they are very infrequent. The benefits, on the other hand, are huge. The benefits are something which every patient gets. So, who are the patients who need a knee replacement surgery? That is the most important question. If you start doing knee replacement surgery on every knee pain patient, definitely they may not feel the benefit. So when we advise surgery, we always advise surgery to those patients who have severe knee arthritis, who have significant pain, significant deformity, bending of the knees, and significant difficulty in walking. And these are patients who are not going to get better with anything else other than the surgery. So these are patients who before the surgery are doing very little things. They can barely walk for 4-5 minutes. They can never sit on the ground. They are having pain every time they sit on a sofa and get up. They can hardly do a few staircases because it is very painful. And these are the kind of patients who will tremendously benefit from knee replacement surgery. So what can they expect after the surgery? Once they recover from the surgery, they can do all their day-to-day activities with almost no pain. There is no restriction on walking. Most of my patients walk more than half an hour as early as 1 month after surgery. They are allowed to do staircases up and down, and they can comfortably do staircases after about 4 to 6 weeks after surgery. And all of them are very happy. In fact, I ask everybody, did you do the right thing by doing the surgery? And all of my patients fortunately have said that yes, I have done the right thing by doing the surgery, because what I can do now after the surgery is much more and much painless than what I could do before the surgery. Apart from these things, you have to consider the cost. The cost also nowadays of the surgery is much less. You may be aware of certain price controls on the implants and all which have come in. So it is not an expensive surgery anymore. So definitely it's a surgery which is worth it for a patient who needs it. In fact, knee joint replacement surgery is considered to be one of the biggest success stories of orthopedics, which means that it's a surgery which has benefited millions and millions of people much more than any other surgery has benefited. So I request anyone who needs this surgery to please take the benefit of this surgery. And if you ask me, for the correct patient, it is a surgery which is definitely worth it.